14 East, this is Benny. Hi Benny, it's Mike in the ER. This is my second call to give a report for the patient going to room 14055, bed 1. Yeah, I just found out I was getting this patient. I'm gonna have to give you a call back. Benny, you didn't just find out you were getting this patient. My first call was 45 minutes ago. It hasn't been 45 minutes. Do you know what? Our computers down here have little timers on them. They're really great. So I know exactly when the last time it was that I called you to give a report. Why don't you just give me a report? Well, in the past 45 minutes, have you read on this patient at all? Well, I would still like to have a full report, please. This is a 21-year-old gentleman with no history other than IV drug abuse. He has no drug allergies and he takes no medicines on a daily basis. He's coming into the hospital for antibiotics related to cellulitis to his left anticube from a heroin injection. He got a gram of Vanco down here in the ER. He arrived via ambulance and was given Narcan upon arrival because he was unresponsive. Since receiving the Narcan, he's been awake, alert, and oriented ×3. Yeah. How does his skin look? You mean other than the cellulitis in his left anticube? Well, how does his sacrum look? He's an ambulatory 21-year-old. His sacrum looks fine. Yeah, I'm looking at that blood pressure. Did you guys do anything about that? His blood pressure of 146/90 manually, that blood pressure? No, the ER attending, the ER resident, the hospitalist, and myself, we were all fine with that blood pressure. I'm sure. Well, where's his IV? He's an 18 in his right anticube. Great. I guess his pump will alarm every time he bends his arm. Did you guys treat his potassium at all? You mean his potassium of 3.4, which is just slightly out of range for this hospital and would be considered normal at most other hospitals? No, we didn't give him anything for his potassium, but if you want, you can give him some orange juice or maybe a banana when he gets to your floor. Well, are you sure that this patient is suitable for med-surg? And why wouldn't he be suitable for med-surg? Well, with such a low potassium, he really should be on a monitor. His potassium is normal. Did you guys do anything for his pain? No, we had to give him Narcan when he got to the hospital by ambulance, so we didn't give him anything for pain. Awesome. I guess I'll have to take care of that too when he comes up here. What else would you like to know about this patient? His favorite color? No, that's it. It doesn't sound like you guys did much for him anyway down there. I'll just deal with it when he gets here. Well, I mean, if you ever want to show us how it's done, there's plenty of overtime available here in the ER. So you can always bid on a shift and come down here and show us how it's done. Other than that, the patient will be right up for you. Oh, not so fast. That room may be clean, but I don't have a bed in the room. I'm going to have to go look for a bed, but before that I have to go to lunch. So as soon as I come back from lunch, I'll find a bed, and then I'll give you a call right back. I'm sure you will, Benny. Give me a call back as soon as you can track down a bed. Jerk.